Welcome in to another episode of Ask the Doctor. Today, we are speaking with Dr. Jha, a Southeastern neurosurgical specialist. Welcome in, Doctor. What is neurosurgery?
Most people think of neurosurgery as brain surgery, but in fact, neurosurgery is the specialty of medicine that is concerned with the diagnosis and treatment of not just the brain, but also the spinal cord, spinal column, as well as the peripheral nerves.
What is the difference between a neurologist and a neurosurgeon?
The neurologists and neurosurgeons are both concerned with various treatments and diagnoses of conditions affecting the nervous system. But there are primary differences between both specialties, ranging from our training to our focus to also how we treat these different conditions. Neurologists are trained medically in diagnosing and treating conditions that affect the brain, the spinal cord, and the nerves. A lot of the conditions that they treat are not those that necessarily warrant surgical intervention. They also perform a lot of tests such as spinal taps, EMGs, and EEGs that help diagnose certain conditions of the brain, spinal cord, and nerves. And they may also treat conditions with non-surgical measures such as medications, physical therapy, and spinal taps. Neurosurgeons, on the other hand, have undergone a surgical training and are primarily concerned with conditions of the brain, spinal cord, and peripheral nerves that may require consideration for surgery. We often perform a variety of surgeries on the different parts of the nervous system to treat conditions such as brain tumors and aneurysms and spinal conditions as well.
What kinds of diseases do you as a neurosurgeon treat?
Neurosurgery ends up encompassing a broad breadth of conditions affecting the brain, spinal cord, the spinal column, and peripheral nerves. We treat conditions such as brain tumors, conditions that affect the blood vessels of the brain, such as aneurysms, vascular malformations, and even opening up blockages of arteries going to the brain. We also perform surgeries to treat several conditions on the spine, such as arthritis, herniated discs, pinched nerves, and even pinched spinal cord tumors.
What are some common surgeries or procedures?
Some of the most common surgeries that we perform as neurosurgeons on the spine are to take pressure off of pinched nerves or even the spinal cord. These conditions can affect patients' quality of life and even neurologic function. On the brain, neurosurgeons perform surgeries to remove blood clots that are pressing on the brain and causing increased pressure within the skull. Neurosurgeons perform surgeries to remove brain tumors of the brain or the surrounding structures from the brain.
Is surgery always necessary for pinched nerves of the spine or for spinal cord compression?
The effect of the pinched nerve or spinal cord on the patient's neurologic function is considered. The severity of the pain that a patient may be experiencing from a pinched nerve. During consultation with a neurosurgeon, the patient is also examined to evaluate their neurologic function and take note of any deficits, whether it's strength, fine motor ability, or sensory loss. And of course, imaging is very important nowadays when considering surgery or conservative measures. So a neurosurgeon will oftentimes be reviewing CT scans, X-rays, and even MRIs of the spine.
What could recovery from brain or spine surgery mean for a patient?
Recovery from brain or spine surgery is influenced by several factors, including the patient's age, overall health, and the brain and spine procedure that they are undergoing. I think it's quite safe to say that most patients undergoing a brain or spine surgery are usually able to go home by day 3 or day 4 following the surgery. After surgery, the recovery involves several things, such as caring for the incision, taking medications for pain control, and oftentimes avoiding heavy exercise and activities. Physical therapy is often recommended by the surgeon to kind of jumpstart the recovery and regain activity over the subsequent weeks following surgery. Regardless of the surgery being performed, there's a team of nurses, nurse practitioners, clinic staff, and of course the neurosurgeon that's involved with the postoperative recovery in the days and weeks and even months to come.
This has been Ask the Doctor, presented by Northside Hospital Cherokee.